So diabetic retinopathy are changes to the blood vessels in the back of the eye called the retina. And so what happens in individuals that have diabetes is those blood vessels, the inner walls can start to weaken and they start to leak blood or cause swelling and changes in the back of the eye that can lead to blurry vision. So patients should definitely look to come in and have their eyes fully checked if they are diabetic, and especially if they're noticing blurry vision, any difficulty with nighttime driving, if they feel like there are spots in their vision or any type of floaters or flashes, this can all be an indication that they should get their eyes checked. So typically, to look for diabetic retinopathy, a full dilated fundus examination is required. It's just dilating your pupil, making it larger so that we can see everything that's going on inside the eyes. We can also use fundus photography, so taking pictures of the retina and the lining in the back of the eye. That can be helpful for tracking for changes. Other imaging tools like OCT scans, it gives us a cross-section of all the retinal layers in the back of the eye and can indicate whether or not there's some swelling going on from the diabetes. With referrals to ophthalmology or a retinal specialist, they may also decide to do other testing like a fluorescein angiography, which is contrast that's put in through your blood vessels, and they look for any leakages that might be going on in the back of the eye. So for diabetic retinopathy, if it's converted to that proliferative form, eye injections are sometimes required. Other treatments including laser treatments, and if there's persistent bleeding inside the eye and in the vitreous, the jelly part of the eye, sometimes a vitrectomy, removal of that jelly may be indicated. So anyone that's been diagnosed or is newly diagnosed with diabetes, the key thing is to get your eyes checked. So here at the WEI, we do dilated fundus eye examinations to take a full look at the back of the eye, but as well as the front of the eye. We work along with your healthcare team, so they're aware of what's going on with your eyes because it plays such a key role in what your overall health is.